Hi, my name is Steve Kilburn. I am the Grant Projects Director at the Chautauqua County Department of Mental Hygiene. And I oversee the Chautauqua Substance Abuse Response Partnership. This is a collaborative work of agencies from across our county working in prevention, treatment, recovery, and harm reduction, all working together to combat addiction in Chautauqua County. Well, during this current pandemic, we have been working on some videos to, we hope, let the public know about services that are available here in Chautauqua County, including those services which continue to be available even now during this pandemic. It's my pleasure today to have a conversation with Alicia Snow, who is a physician's assistant at the Chautauqua Center. Well, hi, Alicia. If I could ask you to introduce yourself and what you do at the Chautauqua Center.
Sure. I am a psychiatric PA for the most part. I do substance abuse and psychiatric treatment for all of Chautauqua County, and we do telepsych into Buffalo.
And now during this pandemic, when all of these changes have been taking place, have you been able to continue to treat patients?
Yeah, so what we've been doing is we attempt to have as few people as possible in the center just because of the whole social distancing recommendations set for New York State. However, if there's somebody who really needs to come in, or often sometimes that is based on the comfort level of the patient themselves or the client, they're welcome to come in. We'll take precautions, we'll give them a mask, we'll wear masks, we disinfect between people and all that kind of thing. And but we have allowed people to come into the center if that's what they would prefer to do.
And have you been able to do some of the treatment remotely?
Absolutely. So if you were to call, you would be linked with a counselor. You could do your entire counseling session just like we're talking right now. And then they would go ahead and refer, if you were interested in medications, refer you to a psychiatrist. And again, the appointment could be conducted just like this. You would never have to leave your house or step foot inside another building.
Well, that is really a remarkable level of service.
Kind of. It's kind of cool.
It really is.
Yeah.
So I guess, a question would be, how do you think it's going? It's such a new model for delivering any kind of treatment and counseling, et cetera, in particular. What do you think? Has it gone well?
I think it's gone as good as it can. And for some people, I think they actually prefer it. Especially, if you have a couple kids at home and you're trying to get out of the house and you've got a couple toddlers running around and you're trying to wrangle them to come in for an appointment, to be able to schedule a counseling session during their nap time so that it's convenient for you as a mom, like that's amazing. And it's helped in other ways. So we can do a lot of things on both ends of the county, and you can get in a more timely fashion and all of those kinds of things because telehealth gives us that flexibility.
This has been, of course, a theme, with really, I think, every provider here in our county, those at least that I've spoken to, how they've adapted to the circumstances and largely through the use of telehealth. So another topic that we've been talking about in these series is maybe more particulars about treatment. Let me just begin with kind of an open question. What do you think, in your experience professionally, are some of the reasons that people that are struggling with, let's talk specifically about addiction, don't reach out for treatment, don't reach out for help? What do you think are some of those barriers?
I think some of it is stigma. I think that they're afraid that they're going to be judged. You never know who you're going to meet. You never know if you're going to be judged. You don't know the environment that you're going into. And so sometimes if you are just trying to cold call to get help, it can be really anxiety provoking. And then, you have a million reasons to talk yourself out of it. And I would just like to say, you don't have to talk yourself out of it. We have a lot of resources here. We're all here to help. I would hate for people to feel like they can't come into treatment because they feel like they're going to be judged or that there's not treatment for them. An addiction is very personalized to a person and it's different for everyone. We have a lot of statistics that show there's a very high prevalence of overlap between addiction and mental health. And often people are self-medicating and don't even know they're self-medicating. And so if we can help you with the mental health part, you may not feel the need to have to self-medicate as much. And then that's where we can really help.
Yeah, that is such a good encouragement. And you know, your point too, that addiction in all of its complexities is driven sometimes by an underlying mental health struggle and or related to that, like adverse childhood experiences. That's an area that has really become far more attention given to recently. And what a shame, you know, to be struggling with those things. And then, of course, to layer over that addiction with all of its consequences, and not feel like you can reach out and get help, which, as you said, is there and available.
And really, sometimes part of the greatest part of coming into treatment is being able to understand why you do what you do. You know, a lot of people just don't know. And once you start to understand the psychology behind it, then you really can feel very motivated and empowered to be able to control things on your own, which is great.
You know, I've thought how for anyone, making a significant change in our lives is always a challenge. And probably fair to say it's always has some degree of ambivalence, you know, like I want to change and yet I don't want to change, you know, so it's complicated. And it's difficult. As you said, it's easy to talk ourselves out of making a healthy change. Obviously, what we would want to encourage people is to at least start down that path. Maybe I'd ask you, like, for that person that, you know, it's not an easy step to make, what would you want to say to them?
I would say that the first step is the hardest. Even the change piece, even if you're sitting in my office, the change piece may not come for a while, but we'll continue to talk about it. We'll continue to identify different triggers. We'll work with your counselor so that we can all be a team for you. There's no, penalty for not changing at the right time frame. There is no, it's so personal for everybody that what I would just want to say to everyone is there is help, it's available, and it can be at your pace.
I think that's, you know, a really important message. Yeah, and so if I were sitting with you and I was like, you know, Alicia, I really do want to address, you know, this addiction, but, you know, maybe there's this that's going on. I know it's not healthy. I know, but I'm not ready to change that. Like, is it sort of all or nothing with you, or can
Absolutely.
we talk about like taking it one piece at a time?
So it's your treatment, it's your rate, you get to make choices. I actually sometimes have people say, you're the doc, you tell me. And it's funny that people, you know, that's the way that we've set it up for decades, you know. We're like the all-knowing, but we're not. We're just people and we're just trying to help you. And so I feel like it's really empowering when people get to pick and choose and decide when they're ready, what they want to do as far as their own treatment, whether that's psychiatric or substance abuse. You should have a say in that, and you should empower yourself to have a say in that. It's important.
So like you said, it is often that first step that is the hardest. Because once that's made, they're going to find, talking to you, talking to other staff there at the Chautauqua Center, or really any of the other providers as well, they're going to find somebody that's understanding, that's, like you said, going to ask, if I were the patient, ask me, what are my goals? How am I seeing this going? And then you can come alongside and support me in that.
Absolutely. Most people will tell you that once they can get in front of people and have that initial conversation, that so much of that like anxiety that comes with first meeting somebody kind of like goes away.
I wonder if you could share, Alicia, your experiences and how it is for people who I think sometimes view an opioid addiction as almost hopeless. and being very much trapped. It's a strong addiction, no question about it. But
Absolutely.
speak about your own experience treating folks that do come into the Chautauqua Center looking for help with an opioid addiction.
Sure. So when people come in, they're often very nervous. They are a little bit ashamed of what the questions that we ask them. There's no shame to be had whatsoever. We're asking literally just so we can help you. Patients are wildly successful. There's lots of different products that we can use to help. People can become stable, have jobs, continue engaging with their families, live healthy and happy lives. And I often equate it and I say, if you had diabetes, I'd be giving you medication for that. You have an addiction and I can give you a medication that can make it so that you can function just as well as you would if you didn't have this addiction. So then we talk about what are the personal barriers to trying to get on a product instead of using substances maybe off the street or whatever. And people, when they're ready, they do phenomenally. There's all different products that we can use. We have 4 different prescribers currently at the Chautauqua Center that all do Suboxone treatment. There's Sublocade, there's Vivitrol, there's all different kinds of options that we can give people. And I would say that we're all just very vested in trying to help our community as much as possible.
I think that is so important that people do hear, and we've heard it from others, but to hear it from you as well. Treatment works. People get better. Sometimes this narrative, and to be sure, there are tragic outcomes from opioid addiction, but that's not necessarily how it's going to have to go.
It doesn't have to be that way. It doesn't have to.
It does not have to. One of the things that I think is a prevalent view that we're working to try to address head on, it's this, that taking medication to treat an addiction, aren't I just substituting one drug for another? How would you address that idea, which does get, unfortunately, kind of a lot of traction out there?
It does. I've actually had patients tell me that they don't believe that they're sober if they're still on Suboxone. And so then we go through, often what I tell people is like, I want you to go through a list of things that would be different between you, different from somebody when they're sober and different from somebody when they're on Suboxone. And usually the only difference that they can come up with is that they put a film underneath their tongue. They do really, really well. They engage in every normal activity that other people would. They no longer have to worry about being sick. They no longer have to worry about where they're going to be able to get their next fix, not even because they want to be high, but just because they don't want to be so incredibly ill. And I think that we can all find compassion in that, just because you're using a product doesn't make it so that you're not sober. I mean, I do congratulatory sober dates for a lot of my patients who have been really, really doing really, really well, and they'll say, "But I'm on Suboxone." I know you're on Suboxone. Congratulations, you're doing wonderful. And their relationships are better. Their mental health is better. They're engaged in the community in different ways that they would be without the product. So really what the product does is just makes it so that you don't have to worry anymore. That's it.
Yeah, very well said. And so we really do want folks who either themselves may be viewing this or maybe know somebody that could use treatment to know that treatment is available, treatment works, treatment isn't some kind of a inferior way of life. It is a way to restore functioning in life when that's been a struggle. Well, Alicia, one of the things that I've been asking the folks who have done these videos is, in the midst of all of the changes that now for getting on a couple of months have sort of been imposed upon our lives, how are you doing? How are you coping, you and maybe your family, with all of this?
We're doing okay. I'm still considered essential, so I'm at work every day, as is my husband. So like, it hasn't changed so much for our immediate family. However, I will tell you that we're used to having a village, which includes grandparents and aunts and uncles, and a lot of that's really been cut short, and that we definitely feel that as a family. Just trying to keep our extended family safe, and by doing so, unfortunately, we miss some of the extended family. But overall, trying to utilize things like FaceTime and staying as close in contact as possible, and just trying to remember to just be there for one another as much as you possibly can.
Well, our special thanks to Alicia Snow for participating in this video and for the great work she and the others do there at the Chautauqua Center. We'll leave the contact number of the Chautauqua Center in the posting with this video. And thanks to all of you for viewing this episode of Let's Heal Together, Conversations to Combat Addiction. Stay well, everyone.